We are presenting today hospice nursing. My name is Ann Pearson,
Kimberly Giltberg.
Jennifer Denton.
Latanya Robinson.
and we're going to individually present to you what hospice nursing is.
Thank you.
First up is Shay.
Hi, I'm Kimberly Giltberg. I go by my middle name, Shay. I'm going to go ahead and do a quick introduction to hospice nursing. A hospice nurse focuses their care on patients at the end of their lives. The goals of the hospice nurse ultimately are to provide comfort to the patient, manage their pain, maintain their dignity, and prepare the patient and the family for their upcoming death. Palliative care is something that needs to be gone over in this for hospice nursing. Palliative care, they're sometimes used interchangeably. It's a specialized medical care for people with terminal illnesses. It focuses on providing pain relief from the symptoms and stress of the illness, and also giving interpersonal care between all the staff and the multidisciplinary team and the family and the patient as a whole. Palliative care is provided by a specially trained team of doctors, nurses, social workers, and other specialists who work together with a patient's doctor to provide an extra layer of support. Hospice nurses, I guess you're probably asking yourself, what does the hospice nurse actually do? Hospice nurses work with terminally ill or dying patients to help ensure their comfort and quality of their remaining days. They do this rather than working to fix or cure the patient, because at this point they've already been diagnosed with a terminal illness, so the main focus is just to keep them comfortable and maintain their wishes for death. The settings that hospice nurses practice is usually either in a hospice facility or the patient's home. And most of the time the patient's home is what hospice nurses try to focus on, because that's where the patient is most comfortable, especially at the end of their life. Sometimes, however, though, this isn't possible, so a hospice facility would actually be used. There is some criteria for hospice care. The criteria, the patient has to be diagnosed as terminally ill with less than 6 months to live. And then with certain disease processes, there can be some other indicators that meet the criteria for hospice nursing too. And all these recommendations are made by the patient's doctor. There are some goals of palliative care. The main goal is relief of suffering. This is done usually through pain management and keeping the patient completely comfortable so that they can pass without feeling any of the ailments that come along with some of these diseases. Another goal is just to control the symptoms that come along with them. I mean, an example of this can be like in a congestive heart failure patient, they can be tachycardic at rest. So hospice nurses know how to work with those different symptoms. Another goal is restoration of functional capacity. At the end of life, sometimes you can lose some function of the body, and the hospice nurse is there to actually help maintain dignity, especially with like loss of function and daily life with these patients. Respecting the patient's personal, cultural, and religious values. This is really important for the hospice team. They must work with the patient and recognize their wishes as well as their family's wishes so that they can be more comfortable and they can actually be satisfied with passing on. And I think the ultimate goal of palliative care is just to improve the quality of life for the patient as well as their families.
Hi, I'm Jennifer Denton, and I'm going to talk to you a little bit about the educational requirements for a hospice nurse, teaching and learning strategies for when that time or when you have a loved one or a patient that's going through hospice care. So in order to become a hospice nurse, you first have to have an active registered nurse license. That's important. The other thing is you have to at least have 2 years of experience in that specialty to become or apply for your certification in the hospice field. Once you apply for it and you've met those credentials, you will take a test, pass that test, and you can get your certification. It's called CHPN, or Certified Hospice and Palliative Nurse. Now, you do have to keep up with your CEUs just like any other certification in order to keep it active. Some teaching and learning strategies is that you need to be able to understand the end-stage disease process. So you'll learn that through your 2 years of experience there, kind of what to expect, what are the stages, and how to handle those. Managing pain is a big one in hospice care. We want to make sure these people are comfortable and that they're not in any pain, and we can learn steps to help alleviate that. Providing care physiologically and social, not only for the patient, for the patient's family. It's a tough time for everybody, so we want to make sure that everybody's aware of what's going to happen and what's to follow and how we can help each other get through it. Some other things is you want to be educating and advocating for our patients. If we see that they're in pain and we don't think that they're getting what they need, we need to be able to collaborate with other team members and other medical care providers to make sure that they're comfortable and that patient and the families have what they need in order to be able to say goodbye. Understanding loss and grief issues and do bereavement care. We need to be able to understand, like she said, when to kind of say, when to say something or when not to say something, when to just be quiet and just be a listening ear. I've already talked about practicing with other medical care providers. We need to be able to team up and just talk about what's best for this patient and how we can handle it for them. Understanding ethical and legal considerations, we do have to realize that we still have to follow the ethical guidelines for hospice care and and legal issues. Being aware of community resources for patients. We need to be able to know what's out there that we can provide for them and provide for the family if they need any additional care. The patient-centered care is, I found several articles about this, and this is what hospice is trying to be more focused on, is the patient-centered care. It just means it's an advocate for the patient. We try to do what's best for them, communication at the time of death. They do a lot of talk about silver hour, and silver hour is basically a flexible model that measures the quality of life care. It focuses on the care of the patient between the time that death is first recognized as imminent and until that patient leaves the site of death for burial. They talk about 3 different stages. You have the dying stage, the death stage, and the dead stage. And I'll go over each one of those briefly. The dying phase is the goal of these, and each one has a goal that they try to obtain, is the goal of this one is for the family and the patient. Once they realize death is imminent, they want to be able to provide the family enough time to spend with the patient. So anytime that they need, they can come in and visit, just kind of be in communication with them. The death phase is your declaration of death. This follows the patient's wishes. So in the other stages, we kind of go through everything, what the patient wants, what they don't want. So this is where we follow their wishes. And this goes until the patient is dead and the body is released. The dead phase is your post-mortem procedures, where the goal in this phase turns from not being so much on the patient, but on the family and helping them grieve and helping them focus on what they would need in order to transition into the next phase, where they would then call their loved one an ancestor. Thank you.
Hi, I'm Latanya Robinson again, and I'll be talking about the multidisciplinary hospice care team. First off, the first people that are involved with this situation is the family. They will be the primary caretakers of the patient and also providing relief care for each caretaker that's individually involved with the patient involved in hospice. Next is case management. They assess home care needs. They also assist patients, family members with concern and empathy. They also evaluate and perform ongoing assessments and revise plans of care as needed. Next up is doctors. They actually make the initial hospice referral. They decide the course of action in regards to when to stop treating the disease and when to start focus on pain treatment and comfort. They also do the initial plan of care, and they focus on treating and managing pain. They also deal with your patients, other healthcare professionals that are involved in caring for the patient initially. And then lastly, they sign the death certificate. However, for this situation in hospice care, they don't have to be at the scene at the time of death to sign. A nurse can pronounce the patient if the patient has expired. The doctors have to sign the certificate at a later date and time. Chaplain services, their primary goal is to provide support to people of all faiths, even if you are without any spiritual group. Next up is skills needed to be a hospice nurse. The first one is communication. I think that's a basic skill for all nursing. You have to be sensitive and facilitative, with patients and other care members of the team. You need to know what to say, when to say it, or to say nothing, based on the situation, and to also be aware of how to provide therapeutic comfort. Next up is psychosocial skills. These skills, with this, you have the ability to work with families, anticipating their needs, putting them in touch with services, and supporting them. Next is teamwork. Teamwork goes with every job that's out there. You have to be able to work well with others, and always be there to support your patient. Physical care skills. You also have to provide active hands-on care when necessary and throughout the long period of illness for this patient and the patient's family. Life closure skills. This is an area concerned with nursing behaviors and skills that are crucial to patients and families' dignity and when life is close to ending and thereafter. Such care has been decided, such care is like sacred. You're going into someone's home, into their personal space, and you have to treat them accordingly. Interpersonal skills involves the need for nurses to recognize and attempt to understand personal reactions that occur with the natural consequence of working with dying and the bereaved family. And to be able to reflect on how this affects care given in these sensitive situations. Thank you.
And finally, my name is Kirsten once again, and I'm going to introduce what we learned today. Most nurses consider hospice as a calling. It takes the right person and a special person with the right personality and temperament, and to be adaptive to the emotional situations and that come with grief and loss during this time. As most people want to avoid death, hospice nurses embrace it. Our hospice nurses are more than just nurses. They do have many different roles. They have patient care, where they are care managers, educators, advocates for the patient. They have awareness of each patient's physical, emotional, spiritual, and physical and cultural aspects that may influence their health as well as their quality of life. They're also there to provide support for the family members and give the caregivers as well as the family members of the patients who are in hospice the support they need. They give them education, they listen, and they help alleviate some of the burden that's associated with a patient who is currently in hospice. And then maintaining balance, and that's a big thing for not only regular nurses, but more importantly for hospice nurses. Just like any other nurse, hospice nurses need to recognize compassion fatigue and burnout, and find different ways to prevent it. Things such as exercise, getting adequate enough amount of sleep, healthy diet, journaling, and meditation are things that can help the hospice nurse deal with self-care. Also, one other thing is knowing that it is okay to grieve and find ways that are individualized for themselves. This will help them prevent stagnation and the buildup of emotions that are associated with the loss and the death and dying of somebody. because they are also losing somebody in addition to the family members losing somebody. Most importantly, we are all human in this. And thank you for your time. And I hope you enjoy our presentation. Any feedback would be appreciated.